My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Warnell.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment is here. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live with Anand just after treatment, and he was having dysphonia due to vocal cord paralysis, and we did earlier his live also. That voice sample I am going to play during this live, so please be connected with us. So नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर, और आज हम लोग लाइव हैं पोस्ट ट्रीटमेंट के बाद, और हमारे साथ हैं आनंद जस्ट. इनको वोकल कॉर्ड पैरालिसिस की समस्या थी, और हमने इसका ट्रीटमेंट से पहले का भी लाइव किया था ऑलरेडी, पहले हमने किया था, और जो डेट है वो था 26 जनवरी को हमने किया था ट्रीटमेंट से पहले वाला लाइव, और आज हम लोग ट्रीटमेंट के बाद का लाइव हो रहे हैं. मतलब कि जो ट्रीटमेंट से पहले का लाइव था वो 26 जनवरी 2022 को किया था, और आज हम लोग ट्रीटमेंट के बाद लाइव हो रहे हैं 18 जुलाई 2022 को. So Anand, just tell us exactly when we started the therapy, where you were and what was the problem and why you contacted us. Okay, please tell us. We are live at our YouTube channel.
Hi everyone. I'm Anand. I was in USA for last 5 years. So in year 2020, I was having tongue and neck cancer. So I underwent surgery followed by chemotherapy and radiation. Everything was very fine. After 8 months, it was a relapse, and I was again infected with neck cancer. This time the face was not fit for surgery. So I again went chemotherapy and radiation. But this time, the doctor has already said you will have too many side effects. So once the therapy, chemotherapy and radiation was over, my voice was normal, but not very clear. It was due to some different reasons. But later on, what happened? Once again, I was, I think, in December 2021. Yeah. I was one day I was not able to speak. I mean, my voice was not even audible in the room. I was trying to say something to my wife, and she was not able. First of all, she was not able to hear what I was saying. And second thing, when I tried to speak loudly, it was not understandable. So all of a sudden, it was like a drunken voice. Where your voice is not very clear. We must have seen the people who are there, and when they speak, what kind of audibility of the voice was. I was very much in distress, so I contacted the doctor once again, and they said after some evaluations that it is a case of vocal cord paralysis. So my left side of vocal cord was paralyzed. I said, okay, this is another addition to my problems, ongoing problems, but what is the solution? So after examining it, they said, no, there is no solution. You have
Okay,
to.
1 minute. So the doctor in USA, those who are treating your cancer, they told after vocal cord paralysis, once it happened, there is no solution, they told.
Yeah, there is no solution. It simply means you can never, you have to live with this problem. And then I asked, is there any way for the betterment? So they said it was not very clear that will it be better in the coming time or what. Neither I was suggested any sort of exercise, any sort of therapy, no, nothing. So,
So we'll summarize it because people will watching. So you decided to take online voice therapy from me because your USA doctor told there is no solution for this problem. So now you can tell us after the therapy, what changes you are observing.
So after when I started my therapy, so I was not sure, but yes, somehow after looking at some of your old videos on YouTube, I got some feeling that okay, my case. Let me refer my case to this guy, to Mr. Sanjay Kumar. I don't know whether something good or bad will happen or not, but yes, I thought. हार क्यों माना? Let's give it a try. हारना क्यों है? If something good happens. Otherwise, I already have to live with it. So when I started with you, initially for so many problems, you started with, and you also told me initially in a very tough manner that I cannot guarantee anything.
So my question is just 1 minute. Let's be little specific so that people, those who are watching this YouTube channel, they will get some idea. So after the therapy, just what changes you are observing? Just summarize in 1 or 2 sentences.
Thanks. I initially, even to speak a word, I had to put too much effort, and my quality of my voice was very bad. I told you, when I started in the same living room, my wife was not able to hear what I'm trying to say. Second thing, the voice was not understandable. So, audibility as well as the tonal quality of voice both was badly impacted. But now, I won't say it is 100% sure, but yes, I am with you. I am able to tell you I can say with some confidence that yes, things have improved. Even others have also noticed that my quality of my voice has changed.
So earlier you told your wife was not able to understand what you are speaking after the vocal cord paralysis, and now after some therapy sessions, what is the change she is observing? What she is telling?
So not only my wife, my relatives also are able to understand what I am trying to say. It happens 95% of the time, but yes, 5% of the time they also fumble.
Okay, fine. So I'll be just playing your. Thank you. So I'll be just playing your pre-treatment videos also, so that will give better information. So that was done on January 26th. You can mute your mic. And that day, I just want to tell on the January 26th, somehow I was doing the live and my mic was muted. Somehow my voice will not be there, but you can hear Anand's just voice. And the link we have given in this live. So please check that one. I'm going to play that one.
So I am currently staying in Chicago. And in 2019, I was diagnosed with tongue cancer as well as neck cancer. I underwent surgery followed by chemotherapy and radiation in 2019. So at that time, my voice got affected a little bit. In 2020, the cancer came back once again, and I.
Yeah, so just I was playing your pre-treatment voice live that we did on 26th January. And those who are watching this live, if you are able to see the changes in Anand's just voice, please like this video, share this video so that people having vocal cord paralysis, they can get some hope and motivation. And in this live, I'll be also talking about a few things. I missed to introduce myself, so I'll be introducing myself, and I'll be talking about cause, signs, symptoms, and treatment of vocal cord paralysis. That will be non-surgical. That is just for awareness purpose, and also I'll be talking about like kind of services we provide and who are the good candidate for our voice therapy services. How to contact us? Where is our center? I'll be talking about treatment, cost, duration, online or offline, and how to differentiate between professional speech language pathologists and healthcare quacks, and where to report if any healthcare quacks other than speech therapists giving speech therapy and damaging your voice and vocal cords, or your communication problem they are deteriorating, and tips to keep your voice healthy. So these are the few things we are going to talk. So let's first introduce myself. My name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist. I did my graduation in the speech and hearing science from AIIMS, Delhi, All India Institute of Medical Science, New Delhi. So my degree name is Bachelor of Science Honors in Speech and Hearing from AIIMS, Delhi. And I did my post-graduation from University of Mysore, and my degree name is Master of Science in Speech Language Pathology. And my passion is treating voice disorder. And of course, by profession, I'm an audiologist. So I do hearing evaluation and hearing testing, hearing aid trial and hearing aid fitting as well for the suitable candidate. And so this is a small introduction about myself, and kind of and I'll be talking about sign, symptom, and cause of this vocal cord paralysis. Yeah, so just for awareness, I'll be talking on that also. So for to understand the cause, symptoms of vocal cord paralysis and treatment, let's first understand the normal speech production mechanism. For normal speech production, first thing is the thought that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord, and vocal cords start vibrating like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, known as articulators. And when we say one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound to different sound. In one sentence, there are so many words, each word has so many sound, each sound is own place, own manner of articulation. So it is a little complex process. In this process, hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that can be seen in case of stammering problem. And here the problem what Anand just is having two stage phase. He is challenging the problem. One is the vocal cord was paralyzed, and other is tongue has been removed due to the cancer, certain areas of the tongue. So the glossotomy we call it technically. So that's why the pronunciation is not clear. And even the vocal cord paralysis, because of the vocal cord paralysis, there was a wastage of air, there was a phonatory gap, so even the loudness was not sufficient before treatment. But after treatment, as he's telling, people are able to understand, his family members and the wife and the other, even the office people. So he's feeling better, as he told. And why I am telling, because of his tongue surgery, some part maybe you will not be able to understand. So that's why I just informing. Already has informed, but the clarity is not as normal people, because vocal cord was paralyzed and the same time tongue has been also removed, certain part of tongue area. So the for sound generation, as I told, air pressure we put below the vocal cord, and the vocal cord vibrates and sound generate. So when the vocal cord vibrates like the string of a violin and guitar, at the same time it will come closer also, and there will be very small gap, and from that air will be coming out. So if the vocal cord is paralyzed, so what will happen? The air will escape between the vocal cords. The wastage of air will be there. In his case, Anand's case, left vocal cord was paralyzed. So suppose if he's saying anything, or even he's saying vowel, so right is coming towards the median position, but left is not coming. So if left is not coming, there is a phonatory gap. And because of the phonatory gap, a lot of air was escaping. So the amplitude of vibration of the vocal cord was less. Because to vibrate the vocal cord, air pressure is creating the energy. to vibrate that, putting the air pressure below the vocal cord. And now, because of the vocal cord paralysis, there is a gap, so air will be escaped. So air is getting wasted. So the amplitude of the vibration, because energy will be less to vibrate the vocal cord, so the amplitude of vibration will be less, and then the loudness will be less. Breathiness will be the sign and symptom in that cases. And why the vocal cord paralysis happen? The nerve which supply to the vocal cords are technically called recurrent laryngeal nerve. That is a branch of vagus nerve, 10th cranial nerve. And due to some surgery, or due to some infection, due to some injury, or sometime due to idiopathic reason, we don't know the reason. It may damage that nerve, damage recurrent laryngeal nerve damage. Then the nerve impulses will not reach into the vocal cord, and the vocal cord's movement will be restricted, and the phonatory gap will be there, and the voice quality will be impacted. So that happens. And so if you have a voice problem more than 2 weeks, breathiness is there, loudness is not sufficient, so of course you should meet to the professional to know the reason. And now who are the kind of services we provide? Yeah. So to understand the kind of services you provide, I'll be suggesting those who are watching this live, please refer our YouTube channel playlist. Once you'll go to our YouTube channel playlist, you'll find different communication disorder playlists, and that will be, all the playlists will be having pre and post treatment videos, and that will give you an idea how much time it takes for the particular communication disorder. So just for idea, I'm telling, if you'll explore our YouTube channel playlist, you'll find the playlist of vocal cord paralysis patient pre and post treatment videos. You'll find the stammering, you will find puberphonia, high pitch voice, you will find the phonatory gap, sulcus vocalis, spasmodic dysphonia, misarticulation, stammering, after stroke aphasia happened, and once after doing the hearing testing and the hearing aid was fitted, and how the patient communication improved. So this kind of video you will be able to find. And functional aphonia also, it's a very interesting kind of communication disorder. You should must watch that. So please refer our YouTube channel playlist to know the kind of services we provide. And in the treatment of this vocal cord paralysis, what we do, suppose left vocal cord is not moving. So what we can do with the vocal exercise, technically called voice therapy, we can either stimulate the left vocal cords to move. That can be also a situation when the communication of the patient improves. Or if left is not moving, then let's bring the right vocal cord more towards the left. So then also the phonatory gap will reduce, and finally the communication will improve. The voice quality will improve. So that we do in non-surgical method to manage the vocal cord paralysis. And so I spoke sign and symptoms. Sign and symptoms will be the breathy voice, loudness will be less. But of course, you should go for the stroboscopy or laryngoscopy to understand the problem of the vocal cord paralysis. And the treatment goal will be to bring the vocal cord more closer towards each other, either stimulating the paralyzed vocal cords or bringing the right normal vocal cords towards the paralyzed one. So in any cases, the voice quality improves. And next topic what I wanted to talk was how to contact us. Okay, sorry, before that was who are the good candidate for our voice therapy services. So for our voice therapy services, everyone is not a good candidate, because those who think in the beginning only it will be wastage of time and money, for them message is sure, you may be right. And those who are thinking this voice therapy service is going to help them, then also they may be right. So motivation is the most important factor. And for all communication disorder, we don't provide online voice therapy services, because my finger and the patient larynx or neck should be present in my clinic. So in online, my fingers will not work there. So there are certain communication disorder we provide online, but for other communication disorder, voice disorder, we don't provide. In some cases, yes, any of the method is fine. And sometimes we get call at our clinic before starting the therapy. Sir, are you going to take 100% guarantee? So this kind of question, those who are asking, I think they are not mentally prepared at this moment for the voice therapy, because in any profession there may be success and there may be failure. So this kind of question, those who are asking, they are also not good candidate for the voice therapy, what I have observed. And how to contact us, where is our center? So our center is at Bangalore, and where is our center on the Google map? To understand that, please refer the description of this video, and you will find the website, our website. Please click our website, and then you click reach me. Then you'll find our email ID on Google map, where is clinic situated, and our contact number, all the details. And the people ask treatment cost, duration of treatment, online or offline. So for that, I suggest patient to please call us. We'll do the perceptual evaluation, and after that, Sometimes certain tests will be recommending, and then only will be commenting on treatment duration and treatment cost. So in the vocal cord paralysis also, all the patient will be not be taking exactly the same time what Anand has taken. Different patient therapy duration will be different and changes will be different. So to understand the vocal cord paralysis, how much time it takes, what changes happens the patient, my suggestion is please refer our YouTube channel playlist who is having the vocal cord paralysis videos, so many, so please refer that. And so once we do the perceptual evolution, then we suggest the patient to go for certain tests, and sometimes we don't suggest any test, and then we comment on the treatment duration, treatment cost. Sometimes very interesting question patient asks, sir, I have the hoarse voice, how much time it will take and how much will be the treatment cost? So when the patient is having the hoarse voice, it may be due to the vocal cord paralysis, it may be due to the vocal nodule, it may be due to the vocal cord polyp, it may be due to the vocal cord cyst, laryngeal cancer. So there can be n number of reasons. So before understanding the reason, it is very difficult to talk about the treatment cost and duration. So for that, I suggest patient please call us if you have any communication problem and you want to take appointment. And next was how to differentiate between professional speech therapists and healthcare quacks. Nowadays in India, sometimes because of the unemployment, there may be some healthcare quacks will also write with their name speech therapist, audiologist on the social media pages, and the innocent people get trapped with them. So whenever you are going to take the speech therapy, voice therapy or audiological services, first you try to find out if the person is saying he's an audiologist, speech therapist, voice therapist or a speech language pathologist, like if he is registered in the Rehabilitation Council of India or not, and if he has registered, what is the RCI number, in which year he got the degree, from which university and which college, like from which college, and his college was affiliated by which university. So just behind that, he's having the bachelor degree or master degree in this field. तो जो लोग भी स्पीच थेरेपिस्ट होने का दावा करते हैं, ऑडियोलॉजिस्ट होने का दावा करते हैं, वॉइस थेरेपिस्ट या स्पीच लैंग्वेज पैथोलॉजिस्ट होने का दावा करते हैं सोशल मीडिया पेजेस में, तो आप उनके पीछे पड़िए और कुछ चीज़ों के बारे में जानकारी प्राप्त कीजिए कॉन्फिडेंटली. अगर वो चीज़ों को छुपाते हैं तो आप एक झोला छाप से ट्रीटमेंट कराने चले हैं. जैसे कि क्या आप पता करने की कोशिश करेंगे कि आपका स्पीच थेरेपिस्ट जो है या ऑडियोलॉजिस्ट है रिहैबिलिटेशन काउंसिल ऑफ इंडिया में रजिस्टर्ड है कि नहीं है. रजिस्टर्ड है तो रजिस्ट्रेशन नंबर क्या है, कौन से ईयर में क्या डिग्री उसने प्राप्त की, किस कॉलेज से और उसका कॉलेज किस यूनिवर्सिटी से एफिलिएटेड था. क्योंकि आजकल बहुत सारे झोला छाप किस्म के लोग ABCD कुछ कॉलेज का भी नाम लिख देंगे और कुछ डिग्री या कुछ भी लिख देंगे ABCD, लेकिन अपने कौन से ईयर में प्राप्त किया उन्होंने अपने डिग्री, ये चीज़ों को छुपाएंगे. क्योंकि अगर उनके क्लासमेट्स होंगे तो वो ट्रैक कर लेंगे, तो उनकी झोला छाप की जो ये है उसको लीगल एक्शन भी लेती है रिहैबिलिटेशन काउंसिल ऑफ इंडिया अगर कोई रिपोर्ट करता है तो मैं सजेस्ट करूंगा कि ऐसे लोग जो कि झोला छाप की आपको अगर नुकसान पहुंचाते हैं तो आप रिहैबिलिटेशन काउंसिल ऑफ इंडिया को रिपोर्ट कर सकते हैं. तो जरूर पता कीजिए RCI नंबर, कॉलेज, यूनिवर्सिटी, डिग्री स्पीच थेरेपी लेने से पहले किसी से भी अगर आप ले रहे हैं तो. एंड टिप्स टू कीप योर वॉइस हेल्दी. सो ये था हमारा लास्ट टॉपिक. सो those who are watching this live, those who are not having any communication problem and those who are not having any communication problem, for them certain tips I'm going to give. Water is a very, very good lubricant. To drink plenty of water, 10 to 12 glass of water in one day is very good. And don't drink very cold or very hot water. It's room temperature water is very good for your voice and the vocal cord. Avoid shouting. When we shout, there will be friction between the vocal cord and that may damage and it may result into the vocal nodule. Don't do frequent throat clearing. बार बार ऐसे नहीं करना. बार बार करते हैं तो vocal cord में friction होता है. तो इन चीज़ों को avoid कीजिए to keep your voice healthy. And avoid smoking. If you smoke, there is a chances you will develop the vocal cord polyp and there will be some structure will develop on the vocal cord and there will be breathiness, hoarseness in the voice. So avoid smoking. If you are a professional voice user and suppose if you are a teacher and you have to give a lecture and the classroom is very big, so ask your administration if they have not provided you the amplification device to put the amplification device in the classroom so that you should not put a stress on the your throat or vocal cord. So these are the few things if you can apply, you can keep your voice healthy. And if you have any voice problem for more than 2 weeks, please contact the right professional. So thank you all, love you all for joining and watching us. And if any questions are there, please write in the comment box and we'll be answering. Some people have joined. I want to say thank you all those who have joined. Ajay Cormel is saying, is sulcus cure हो सकता है? Please help. So it's very interesting. Sulcus vocalis is a condition where nature will not give sufficient mass and the length of the vocal cord. So if sufficient mass and the length of the vocal cord nature has not given, so by voice therapy, I can't give the new mass and new length. So whatever the experience we have in sulcus vocalis patient, like most of the patient has not got impressive result. So if any vocal cord vibrate or any string vibrates, the formula relation between the vocal cord mass, length and tension is L is equal to 1 by 2L under root T by M. So in the sulcus vocalis, the mass and length will be less, the N will be frequency will be higher. So I can't give the new mass and the new length. So if I'm not giving new mass, new length, so I'm not able to change M and L. So it's very difficult to change the pitch. But of course, frequency is directly proportional to the tension. So if I can teach the patient to talk in a more relaxed manner, so slightly if you can reduce the tension, then also the frequency will reduce. But change will not be very, very impressive in most patients. In some patients, we have seen some changes. So Ajay Cormel, thank you for asking the question about the sulcus vocalis. And next question is Tim is saying, सर मुझे सल्कस वोकलिस प्रॉब्लम है और डॉक्टर ने मुझे कुछ एक्सरसाइज दी है, आप बता सकते हैं कि एक्सरसाइज को कितने रिपीटेशन तक करना चाहिए, एक साथ कितनी एक्सरसाइज? तो आपके डॉक्टर ने दिया है तो आप उनसे भी डिस्कस कर सकते हैं, और ज़्यादा जानकारी चाहिए तो हमें कॉल कर सकते हैं, हम आपकी आवाज़ को सुनेंगे, समझेंगे और जो भी आपके रिपोर्ट्स है उसको देखेंगे, फिर कमेंट करेंगे। और जीवन क्षेत्र लिखते हैं, सर मेरा भी वॉइस प्रॉब्लम है। तो गबन क्षेत्री, आप हमें कॉल कीजिए, आपकी आवाज़ को सुनेंगे, समझेंगे, फिर अकॉर्डिंगली हम सजेस्ट कर पाएंगे कि क्या प्रॉब्लम है और एक्सपेक्टेड रिजल्ट आउटकम क्या होगा, हम हेल्प कर पाएंगे कि नहीं, ऑनलाइन हेल्प करेंगे या ऑफलाइन हेल्प करेंगे, जो भी कुछ होगा तो प्लीज़ आप हमें कॉल कीजिए। और हमारा कॉन्टैक्ट डिटेल्स है, इस लाइव वीडियो के डिस्क्रिप्शन में जाएंगे तो हमारा कॉन्टैक्ट डिटेल मिल जाएगा, हमारे वेबसाइट मिलेंगे, उस पर क्लिक कीजिए रीच मी, फिर आपको मिलेगा ईमेल आईडी, कॉन्टैक्ट नंबर, गूगल मैप पे कहाँ पे क्लिनिक सिचुएटेड है, सारी जानकारी मिलेंगी। तो थैंक यू गबन छेत्री फॉर आस्किंग द क्वेश्चन। प्लीज सर आई ऑल्सो कंसल्ट यू, इफ यू वांट टू कंसल्ट प्लीज कॉल अस फॉर परसेप्चुअल इवोल्यूशन फर्स्ट, एंड द कॉन्टैक्ट डिटेल्स आर इन द डिस्क्रिप्शन ऑफ दिस वीडियो एट आवर वेबसाइट। तो जो लोग भी इस लाइव में जुड़े, मैं सबको धन्यवाद देना चाहूँगा, और थैंक्स आनंद फॉर कमिंग लाइव इन स्पाइट ऑफ हैविंग सो मच challenges. You are fighting with cancer, you are a fighter. In spite of that, you came on the live, and maybe after watching your video and with your feedback, there maybe so many people will get hope and motivation. Anything you want to give a message in short, just please give the message to the people having vocal cord paralysis and fighting with the cancer together.
Just don't lose hope, keep trying, and don't think that things will be better in 1 month, 2 months. Our life is very long, and we will have always challenges. Just keep trying, and I am sure things will improve sooner or later.
तो हिंदी में एक बार बता दीजिए आनंद, उस समय जब हमने असेसमेंट किया था आप यूएसए में थे लेकिन आप इंडिया से हैं, तो हिंदी में भी थोड़ा बता दीजिए क्या मैसेज देना चाहेंगे जिनको इस तरह की समस्या है।
लाइफ है तो बहुत प्रॉब्लम्स आते रहेंगे, अगर लाइफ में प्रॉब्लम्स नहीं है तो लाइफ नहीं है, और कोई भी प्रॉब्लम्स आए हमें उसके साथ हमें उसको हैंडल करना पड़ेगा। हमेशा दो सिचुएशंस होते हैं, या दूर भाग जाए या तो प्रॉब्लम को फेस करें। तो मैं ये सजेस्ट करूँगा, प्रॉब्लम कितना भी कठिन हो, लेट्स टेक द बुल बाय द हॉर्न। जो सांड होता है ना, उसको उसके सींग से पकड़ो, देखते हैं क्या होगा, और जब आगे बढ़ेंगे तो रास्ता निकलता है, रास्ता मिलता है, जैसे मुझे मिला था। मुझे डॉक्टर ने बोला था अब कुछ नहीं हो सकता, पर हाँ मैंने यूट्यूब में सर्च किया, थोड़ा भरोसा किया, और मैं जो कुछ भी बोल पा रहा हूँ वो आपके सामने है लाइव। तो चैलेंजेस है, फेस करो, आगे बढ़ो, होपफुली थिंग्स विल बी बेटर, चीजें अच्छी होती है। तो बट आई डोंट नो, मैं ये नहीं कह सकता कि उसका टाइमलाइन क्या होता है। आप मेहनत कीजिए, हम अपने एफर्ट करेंगे, हम मेहनत करेंगे। Sooner or later, मतलब मैं इसको हिंदी में नहीं बता सकता इसका मतलब क्या होता है। तुरंत या आने वाले फ्यूचर में चीजें इम्प्रूव करती हैं, समय के साथ चीजें भी बदलती हैं।
थैंक यू आनंद, इतना अच्छा मैसेज देने के लिए। और उम्मीद करता हूं कि जो आपके फीडबैक हैं कि पहले से आप बेहतर हुए कैंसर से फाइट करने के साथ, और आपके जो डॉक्टर हैं यूएसए में, उन्होंने बोल दिया था कि कुछ भी नहीं होगा, लेकिन आपने उम्मीद नहीं छोड़ी और ऑनलाइन वॉइस थेरेपी के लिए मुझे ढूंढा और थेरेपी सेशन लिए और आप पहले से बेहतर हुए। मैंने क्योर नहीं किया है, लेकिन आपकी बात पहले लोग समझ नहीं पा रहे थे, अब समझ पा रहे हैं। यही हमारा अभी छोटा सा अचीवमेंट है। तो थैंक यू। आपको सुन के देख के शायद और भी लोग मोटिवेट होंगे और उनके जीवन में भी आशा की किरण मिलेंगी। और जो लोग इस लाइव वीडियो को देख रहे हैं, अगर इनकी वॉइस में चेंजेस हैं तो वीडियो को लाइक कीजिए, शेयर कीजिए, क्या पता किसी के जीवन में उम्मीद की किरण मिल जाए। थैंक यू ऑल, लव यू ऑल फॉर ज्वाइनिंग अस एंड वॉचिंग अस। हम इस लाइव को स्टॉप करेंगे।
थैंक यू।